One person helps me with the correct answer, I will go ahead. Otherwise, I will not go ahead. Who will give me the correct answer? There are so many anti-epileptics now, doctor. Which one do you want to guess? Which can be responsible for Stevens-Johnson, blurred vision, and can lead to excellent. Dilip gets the big clap. He relieves me out of the life on the planet Earth. That is, lamotrigine is correct. Lamotrigine is the one which need to be remembered, which lead to development of Stevens-Johnson, blurred vision, and GI distress. And lithium is called first line mood stabilizer. And another value, lithium toxicity, when will you get, doctor? More than 1.5 is the golden number, which you are not going to forget. Then coming to the carbamazepine, it leads to aplastic anemia, Stevens-Johnson, nausea, skin rash. It is also a second line mood stabilizer. That way carbamazepine is also a reasonable guess. That's good. It is the endoplasmic reticulum. Secretory proteins are basically formed. Pulses are deficient in methionine, already we discussed this. In case of phenylketonuria, tyrosine formation is not possible in the body, hence it becomes the limiting amino acid. Phenylketonuria, phenylacetic acid will accumulate in the plasma, on the skin, and the mousy odor is what you typically come across. Glucose, fructose, galactose. There is a hexose, and ribose is basically a pentose sugar. That's what our organic chemistry teacher taught us, right? Okay, doctor. Give me one confident answer. Which personality patient is very grandiose? He needs admiration. He has a sense of entitlement and he lacks empathy for others. What is this personality called as? Borderline, histrionic, narcissistic, antisocial. Which one do you like to call this as? What kind of personality do you like to call it as? Dilip says narcissistic personality. That's good. Anantapur, Sumati, everyone agree? Except HI means, who is HI? Himanshu Jain. Who is HI? Manavi says narcissistic. That's right. Grandiose, need admiration. Antisocial means violate the rights of others. Dusre ka haal ticket chhinna is antisocial. He lacks remorse. I disturbed the other fellow, he lacks the remorse. Antisocial. Excessively emotional, attention seeking, sexually provocative, theatrical, drama type is histrionic. Very unstable mood relationship. Today you are my best friend, tomorrow you are my worst enemy. Day after tomorrow, I don't know who you are. That is borderline personality. Now, doctor, invasive carcinoma means what? There is a breach of the basement membrane is what need to be remembered. Now, in acute inflammation, what do you typically come across? Typically in the acute inflammation, there is a persistent vasodilation, and I think this question requires a little modification because all of them basically are seen. Granuloma formation may be more of chronic inflammation rather than acute inflammation. Possibly C becomes a better answer for this question, I believe. Now, yes, chronic inflammation, what you have is granuloma formation. It is not D, correction in the key, it is answer is C, where you find it in chronic inflammation. That's right. What is epithelioid granuloma? That's right, C is the correct answer, small correction in the key. Epithelioid granuloma is fundamentally because of the macrophages, histiocytes which constitute the granuloma is what you are going to remember. Apoptosis means programmed internal cell death is basically called apoptosis. Where do you find red infarct. Hemorrhagic infarcts or red infarcts are due to the occlusion of the veins, as all of you know very well. What is metastatic calcification? Metastatic calcification can occur into most of the tissues like renal tubules, lung alveoli, blood vessel, classical locations where metastatic calcification can occur. Then congruent staining, where do you see, doctor? Green birefringence is a classical refringence pattern which you see in case of amyloid protein. Coming to tumor suppressor genes, it is the SMAD2, not SMAD1, which is considered to be the tumor suppressor gene. Whereas NF1, retinoblastoma gene, P53, they are all the other classical examples of the tumor suppressor genes is what need to be remembered. APC, SMAD2, SMAD4, ST14, they are all the examples of tumor suppressor genes. In apoptosis, there is no necrosis. It is typically non-necrotic in nature. Where do you see hyaline atherosclerosis, doctor? Hyaline. For our earlier question, apple green was there, no? Yeah, apple green, that's right. Okay. Where do we find hyaline? Hyaline in the case of the hypertension, as all of you know very well, hypertension. Now, give me one answer. Which is that autism-like disorder where the social impairment is there, repetitive activities and behavior will be there, but there will be no impairment of language or there will be no cognitive delay. This describes which condition? Is it Asperger, Rett or childhood disintegrative disorder? Social impairment and repetitive activities and behavior and no impairment of language or cognitive delay. It qualifies which condition? Is it Rett syndrome or Asperger? Anuja proposes Asperger, so also Vizag, Shravya, Vijayawada, Manu, everyone say Rett. See doctor, Asperger may marked language or cognitive delay nahi rahega. Without that, you call Asperger. You can remember Asperger knows the grammar because the language and cognitive delay is not there. Who is a Rett? Rett is Rita. Rita is a female. So, Rett disorder is seen in the females with marked language difficulty, coordination and head growth is impaired, and it is seen after 5 months of normal development. Childhood disintegrative means developmental milestones will develop but they later on regress after 2 years. First 2 years, acha, child is going very well, but after 2 years there is a regression. Then you call it as childhood disintegrative disorder is what need to be remembered. So that is the reason, doctor, the preparation for the exam is all very specific ultimately. Initial days you can be little non-specific, you can read very extensively, but it is the time where you need to consolidate everything. You must know how to smell the answer. You should not use your brain in the exam, and reflexly you should answer. So the purpose of our 19-week review course is to bring out the common issues. In our earlier session we discussed cardiology very extensively, but in our review session we will discuss just in 2 days, 4 hours mein entire cardiology mein very essential points are being reviewed. That is the idea of the session starting from this Monday, December 5th. Now doctor, which stain do you use to diagnose amyloidosis? Congruent. Call Exner bodies, granulosa cell tumor is what need to be remembered. Basically call it as dystrophic. हाइपरकैल्शियमिया में जो भी कैल्सिफिकेशन होगा उसको बोलते हैं मेटास्टैटिक. And normal tissues में calcium deposits if the levels are high in metastatic. Abnormal degenerated tissues may calcium deposits, you call it as dystrophic calcification. Myositis ossificans may you also have a metaplastic bone due to that fibroblastic proliferation is what need to be remembered. To diagnose HIV any day, Western blot is most important. We use a Robertson cooked meat medium in the case of the anaerobic bacteria.